Hello, friends. If you or someone you love has type 2 diabetes, this video is for you. I want to give you hope that you can actually reverse type 2 diabetes, and this is not based on a bunch of hype. This is based on real research, so hang with me and let's get to the bottom of this. I really think this information can change your life if you take it to heart, as it has helped many people that I've talked to. All right, so first of all, as a reminder, this is not medical advice, this is educational information. And I'm going to go over this study that appeared in the Lancet Diabetes and Endocrinology. And what it did was it really showed in a really definitive way exactly how much of a chance somebody will have of reversing their diabetes if they lose weight. So it was called Impact of Body Weight Loss on Type 2 Diabetes Remission. It was a systematic review and meta-regression analysis, which is complicated stuff. Don't worry about that. We'll get into it. But what it did was it studied a bunch of randomized high-quality controlled trials. So first of all, it took 22 other very high-quality randomized controlled trials that each of which was measuring the effect of weight loss on type 2 diabetes remission. And what they did was they tested people a year after weight loss so they could actually see the long-term effects as opposed to just following them for 8 weeks or a couple months. And that's really helpful because it gives us a data point of something that's actually long-term. They did not have people using any glucose lowering medications. And the reason this is important is because that could be a confound or a third variable that is explaining the effect that's not a result of weight loss itself. So these patients were not on all these other medications for glucose lowering. So we can attribute the effect of getting to remission or curing their diabetes to the weight loss itself. Now, how do they do this? Let me give you a little more of a focus. So they defined complete remission as the following. Specifically, they looked at what we call the hemoglobin A1C, which is a measure of your blood glucose over the last couple of months. And they defined complete remission of diabetes type 2 as when the hemoglobin A1C was under 6.0. And if you go to your doctor, they probably check this and they'll probably tell you, oh, everything's fine because your A1C or your hemoglobin A1C, it's 5.6. It's fine. You don't have to worry about it. So this is an arbitrary cutoff in some sense, but 6.0 was their definition. And also they looked at another definition using fasting blood glucose of under 100. But partial remission was defined as hemoglobin A1C of under 6.5 or fasting glucose of under 126. So those are your specific definitions of how we're defining partial and complete remission. Now, this is the key graph you want to pay attention to. So here on the left, you're going to see what percentage of people went into a diabetes remission, from 0 to 100%. And on the bottom, on the x-axis, is the proportion of total body weight loss. So what percent of people's weight did they actually lose? So 10 to 20%, 20 to 30%, or 30 or more percent. And then here you have the percentages represented of what percent of people went into complete remission and what percent of people went into partial remission. So for example, for people who lost less than 10% of their body weight, 0.7% went into complete remission and 5.4% went into partial remission, which is really not bad if you think about it. 10% of your body weight. So if you're, say, 200 pounds, 250 pounds, that's 25 pounds for 10%, or maybe 15 pounds for less than 10%, like 7 or 8. It's not bad. That's something that people will report often. If you go to 10 to 20%, 10 to 19% here, 48% of people went into partial remission from their diabetes. That's huge. These numbers are much larger than you might expect. They don't have a data point for complete remission due to some quirks in the study and the number of people in each group, but you can see the linear trend here. You see a line you could draw between all these data points. It's generally going up and it's going up fast. So for people who lose 20 to 29% of their body weight, wow, you get 69% of people into partial remission from their diabetes type 2 and 49% of people in complete remission. So under a hemoglobin A1C of 6.0. That's pretty amazing. So if I told you, if you lose 20% of your body weight, you'll have a 50% chance of going into remission from diabetes. That's something I think that would surprise a lot of people. So if you're 250 pounds, yes, it's losing 50 pounds. But if you consider the weight of the person when they graduated high school or college, it was probably something like pounds or 170 pounds. So they might have an excess of 100, 110 pounds on their body. And if they lost 50 of those, it's not even maybe half of their body weight that they're trying to lose, but they can still have a humongous effect on their diabetes disease course. So the same thing, if you're over 30% of your weight loss on the right here, you have these whopping numbers of 89% partial remission, 79% complete remission. So this graph is incredibly hopeful This graph should change your whole perspective on diabetes type 2. And we're going to talk about exactly what that means. But I hope you will look at this graph. You will share this graph with people you love who have diabetes so they can be motivated and they can know that they can actually improve with weight loss. Now, let's get a little bit more granular. I want to give you even more inspiration. So even a 1% point decrease in body weight increases the chance of people going to complete remission by 2.17% points. So even when you think, oh, if I just lost 1% of my weight, what's the big deal? 1% of a 250-pound person is not very much, right? 2.5 pounds. So it might seem like that's water weight fluctuation on a daily basis. Those things will add up. Every small 1% will add up. And here, this study quantified that. For every 1% point drop in weight, you have a 2% point approximate increased risk of remission. So that's great. Keep that in mind. Every little bit helps. Now, what is important about this is that people really should be focusing on weight loss, because when you go to the doctor, there's so many other things that people focus on. And in this study, age, sex, race, diabetes, duration, baseline BMI, baseline A1C, insulin use, or the weight loss method did not significantly influence the remission rate. And this is really important because these are many of the things people will focus on. I've had diabetes for so long, so it's irreversible. It didn't have an effect on the remission rate here for diabetes. My baseline BMI is so high, so it's not going to work for me. That didn't have an effect either. My baseline A1C is so high, I have an A1C of 12. This is never going to work. I'm far gone. You're not far gone. Insulin use. I use a lot of insulin. I have to inject myself with 30 units of long-acting insulin every morning. And every meal I have to inject myself 10 units, 20 units. It's just so hopeless. It's not. And also the weight loss method. I'm low carb, or I'm carnivore, or I am paleo, or I'm doing the South Beach diet, or whatever diet it is. It didn't really change the remission rate. What really matters is the actual amount of weight loss. So keep that in mind. All right. Now, the other thing, even partial remission significantly reduces complications and improves metabolic health. So even if you don't get to complete remission, even if your A1C doesn't get under 6.0, that partial remission is still progress, because all these things are on a continuum. An A1C of 12 is better than an A1C of 13, and 11 is better than 12, and so on. And 6 is better than 6.5. But guess what? 6.5 is better than 7 or 8. So you're going to see drops in complications and also all these other metabolic problems like diabetic neuropathy, kidney damage, damage to the eyes, blindness, all the horrible complications of type 2 diabetes. So remember, don't focus on perfection. Focus on progress. Daily small changes are wins. They're still wins. So I hope that will motivate you. But there is a caveat here. You have to also keep in mind that in this study, long-term remission rates decline over time. So it's not a matter of just getting there. You also have to maintain it over time. So many people can lose weight, but they can't maintain the weight. So think of weight loss as having two phases: getting to your goal weight and then staying there. And the strategies you have to implement to get there and stay there are actually a little bit different. Not dramatically different, but there are differences. So in this study, due to factors such as weight regain and metabolic adaptation, the remission rates from diabetes are not guaranteed to maintain themselves over time. So as long as people don't regain the weight and they focus on all the things to keep their metabolic health healthy, they're going to be fine. But that's an important caveat. Now, what are the lessons of this study? When you go to your doctor, they might focus on a lot of other things. Aiming for weight loss should be a goal in treating type 2 diabetes. It should not just be about blood glucose control, because oftentimes the endocrinologist or the primary care doctor is so focused on getting that A1C down, they're posing people with insulin. And we know insulin itself is a cause of weight gain. So if you have insulin resistance, you have a hard time losing weight. So one of the goals of diabetes care, I think, should be to decrease the insulin burden that somebody is employing so that they can actually lose weight. And you can often do that by focusing on the type of food one is consuming, getting rid of complex carbohydrates, processed foods, and such things that spike insulin. So it's not just about glucose control. You want to broaden your scope of how you think about diabetes care and weight. Remember, 85% of adults with type 2 diabetes are overweight or obese. So there's a general tendency. Now, that's not necessarily the case, of course. There's those 15%, because you can have a normal BMI and still have type 2 diabetes. You might have a lot of visceral fat. You might be what's called skinny fat. You might have fat distribution in different areas that don't make you look like you're gaining weight. You might have fat deposition in your liver, in your muscles, in your viscera. So there's this general tendency, but it's important to keep in mind that weight loss is still a goal. And don't wait for organs to fail, be preventative. This information is important because oftentimes when we go to the doctor, they're only going to raise their eyebrow when something's starting to fail. Oh, your kidneys are fine. Your GFR is like 75. It's not like you're not in stage 3, stage 2 kidney failure yet. So let's just keep doing what we're doing. You don't want to get to stage 2 or 3 kidney failure. You want to prevent that, right? So these are important approaches because the medical community is often oriented towards urgent care, emergency care, and solving acute problems because there's so many people with so many problems. So doctors will only pay attention when there's something really life-threatening. But you only get one life, so you don't want to wait till you get to life-threatening. So I would really encourage you to focus on being preventative. And also, don't be so pessimistic. Aim high and be hopeful because there's not just this kind of a study. There's so many other studies that can create hope. But our medical culture is very pessimistic, and people's aims with their health are often very low. So if you don't aim high and you don't have a big goal for yourself, you're not going to have a way to orient yourself in your health journey. So I hope I've been able to give you some hope, and I hope this has been helpful for you. If it has, please check out this other video. Please consider subscribing to my free newsletter to keep up to date on these kinds of updates. Take care, and to your health. Be well.